If your newborn sneezes 10 to 15 times a day, you might think they have a cold, but this is actually completely normal. However, there are specific types of sneezing and breathing sounds that require immediate medical attention. I'm about to explain when to worry and when to relax, and newborn sneezing is one of the most common concerns new parents ask me about. Today, you'll learn why babies sneeze so much, how to tell normal sneezing from concerning symptoms, and when to contact your pediatrician. Newborns sneeze frequently for several normal reasons. Their nasal passages are tiny and sensitive. Even small amounts of dust, lint, or milk can trigger sneezing. They're obligate nose breathers for the first few months, meaning they primarily breathe through their noses, not their mouths. Their sneeze reflex is very active. How do you tell what's normal and what's not? Normal newborn sneezing is frequent but not constant. You might see clear or no nasal discharge. Your baby feeds well and seems comfortable between sneezes, with no fever. On the other hand, sneezing that needs medical attention includes thick yellow or green discharge, sneezing with fever, difficulty feeding due to congestion, persistent coughing, or any signs of breathing difficulty between sneezes. Besides sneezing, newborns make a variety of normal breathing sounds that can surprise parents. To reduce sneezing and congestion triggers, keep your home clean but not overly sterile. Avoid strong perfumes, air fresheners, or harsh cleaning products near your baby. Wash hands frequently to limit viral exposure, and maintain comfortable humidity levels in your home. Frequent sneezing in newborns is usually completely normal. It's actually protective. Focus on your baby's overall well-being, feeding, and alertness, rather than counting sneezes. Trust your instincts. If something feels off, check with your pediatrician. Share your experiences in the comments to reassure other new parents. Like this video if it eased your mind, and subscribe for more newborn care guidance from me.